Very special guest today here called Milo. Main job is to look cute on camera, but also going to help us out a bit later on. And today we're talking about parasites and what we can do about them. So we're going to focus on the common ones, so fleas, ticks, worms, that kind of thing. And we've got a few questions have come in already, but if you guys have any questions at all that you want answered, feel free to send them through and we'll try to get to them. And if we can't, we'll get to them after the live Q&A. So the first one is, what are parasites and what makes them so dangerous? And essentially, a parasite is a creature that will live on your pet. It's kind of like having a bad tenant, free rent, kind of taking shelter and food from them. So the issue is that they often at the expense of our pets, our dogs and cats. So whether they're external, so ectoparasites, or internal endoparasites, they can cause quite a few health issues. So it's really important that we know what they are and what we can do to treat them essentially. So how do they get to our pets? It's usually environmental. So our dogs and cats are often outside. Dogs love to sniff everywhere, and they can pick up things from other animals' poo, from the environment. And in regards to worms lay eggs, they're in the poo. They ingest them and then they take, it's what's called a fecal-oral route, so through ingestion, go into the bellies, cause worm burdens, and especially in younger animals like puppies and kittens, can make them quite unwell. Things like fleas that I know you're all familiar with, they're caught from the environment, so they can go from cats, dogs into the environment onto other animals, and they cause really intense itch, and some animals are actually allergic to them. So you might have a flea infestation where you can see the burden, but some animals, one bite is literally enough to set them absolutely crazy with itch. So it's really important that we take care of those as well. And things like ticks, they can be from the bush or especially coastal areas with paralysis ticks. So basically what I'm trying to get at is they can come from anywhere, so we really need to stay on top of things. We had a question about how do we tell if our animal has parasites. So fleas, they're the external ones like we talked about. So you're basically looking through the coat, and the easiest way to do it is to kind of get your fingers and part the fur. Fleas will try to run away from the light, so you've got to be really quick and use your eyesight as best you can. But generally speaking, you part the fur and you'll see a little black or brown bug trying to crawl away. If you have a cat, they are very good at grooming themselves, so they will lick, and you are very lucky to find one. So if your cat's itchy, I'd still consider that it may have fleas even though you can't see them. But a good tip to try and determine whether an animal does have fleas is if you comb the coat, and then you might get a little bits of dirt come out, and it can look like just your normal dirt, but if you then wet it with a paper towel, and then it has like a red streak, that's actually digested blood that the flea has been feeding on, and that can help you distinguish it from normal dirt. So that's a good little tip that you can use there. So we've got another question. Are there parasites that are more common than others? I guess, as I said, fleas are extremely common, and they do tend to become more prevalent in warmer seasons. So now you might be starting to notice your dogs get itchy and your cats as well. Worms are very common too. We typically see them causing issues in younger animals, but it doesn't mean that they're not around for the older ones as well. So it is really important that we treat all our pets just to make sure, and especially if you've got younger and older dogs, you don't want them passing parasites onto the younger ones especially. So what happens if parasites go untreated? So generally speaking, if they're on the skin, they can cause itch, irritation, discomfort, stress and things like that. But another important thing to consider with younger animals, if they've got like a flea, for example, that's feeding on the blood, it can actually cause them to become deficient and become anemic. So they can cause more serious health issues. With the gut parasites, so the worms, they can cause things like diarrhea, vomiting. Because they're competing with the nutrition that the pet's getting, they can actually cause them not to grow as well. So their development can be impacted too. And then ticks, especially paralysis ticks. So you've got your normal bush ticks and brown ticks that can cause just external irritation, similar to fleas, but paralysis tick is a real problem for us here in Australia, especially on the eastern seaboard, and especially now as we're going into spring. And as the name suggests, it does cause paralysis of the animal. So within 3 to 4 days of the tick attaching to the animal, it releases a toxin and it causes a paralysis, usually starting from the back legs or the front legs, causing weakness. And if you can just imagine every part of the body that needs to work, that's going to be affected. So the breathing muscles will be compromised, the swallowing muscles, even the muscles of the larynx may be affected. So the voice will change. If your dog normally barks a certain way, and that changes, and the muscles of swallowing can cause them to vomit, that kind of thing. So that is life-threatening, and it's really important that we're on flea and tick prevention, especially going into the summer months, because it is a disease that is absolutely preventable. So we're going to talk about treatment of all this kind of stuff a little bit later on with some products that we have. But how often do I need to treat my pet for fleas, ticks and worms? And this largely depends on the product that you're using, but also the life stage of your pet. So you might notice that you've gone to the vet with your puppy or kitten and they're saying, look, we need to worm every 2 weeks up until this stage, then we're going to go every month and that kind of thing. And that's purely because younger animals are so much more affected, and it causes more clinical disease in them as opposed to older animals, which do develop some immunity, and it affects them differently. So in regards to worms, you're going to find that the vet is telling you to treat every 2 weeks until they're about 12 weeks of age, and then we're going to go monthly until we're 6 months old, and then generally speaking every 3 months for life. So that'll take care of all the belly worms. They're the ones that are causing vomiting, diarrhea, that kind of thing. Fleas and ticks depends on the particular product you're using, and we're going to go through a few different ones today, but some of them are every 2 weeks, some are monthly, some are 3 monthly. So it's really important just to check the label, check the box, and speak to your vet or pet barn staff about that one so you're using it correctly, because there's no general rule that applies to all of them at the moment. So my pet hate the medicine and won't take it. Do we have any tips or tricks? And this largely comes to knowing your pet and knowing, do they like food? Are they really food motivated? Can I hide a tablet in their food? So if you know they're absolutely going to be guts and devour everything in the bowl, you can hide it in food, but it's really important to check that they've eaten everything, because some are very smart and they will eat around a tablet that they don't like. It is a good idea if you want to cover a tablet with peanut butter or a bit of yogurt. You can put it inside chicken and just make sure that their nose is too busy smelling the chicken and not the tablet itself. But there are some products that are actually tasty and they're chewables, and so a lot of dogs will go for those ones. They'll think it's a treat, but little do they know they're being treated and helping to prevent parasites. So that's a way to go for them. If you're really having trouble getting anything oral in, then the topical treatments, so spot-ons, are really good, and they're just applied generally to the neck or shoulder area, and you part the fur, you're getting it on the skin, and that way it can absorb in there. So there's a variety of ways that we can treat for parasites. There's heartworm injections that can be given at the vets as well, that are year-long. So just have a chat with your vet and just see what works for you and your particular pet. And you might have multiple pets and each one needs a different thing, but the great thing is that we've got so many options available for them now. So next question, am I at risk of getting the parasites if my pet has them? And that's a really, really good question. And we often forget that although they are cat and dog parasites, yes, we are at risk. There's a name for when we get affected by parasites that aren't ours. It's called a zoonosis, and especially younger people are affected. So if you've got kids at home, I'd be really making sure that we're on top of the parasite prevention, because we can ingest things that we shouldn't. So if for example, Milo goes to the park and another dog has a parasite and he's brought that into your house because he's walked on the grass and there's been poo there, and then your young child is playing with Milo and then gets it on the hands in mouth, you can see how easily that can be transmitted. So that's relevant for quite a few of the worm types that dogs and cats can get. Fleas can actually bite people as well and cause skin irritation, but it's really important to think more seriously as well, because fleas can carry diseases, they're called bloodborne diseases, so can ticks, and if they're feeding off the blood of various animals and they have a disease, they can transmit it to other animals and yourself too. So the best thing to do is to make sure that that's not a problem. So, and the closest contact we have with fleas and parasites is through our own pets. And so if we keep them protected, we're also keeping ourselves safe too and our families. What are the common misconceptions about fleas, ticks and worms? I think probably the biggest one that I get is people say my cat or dog is indoors only, therefore I don't need to treat. And I challenge you to think about when you come into the house, have you ever brought in dirt on your shoe or anything like that? Because we can actually carry in worm eggs and larvae through the environment. So if we're walking on dirt, it's going to be there and we're going to bring it in and our pets will find it somehow. So although they are at lower risk because they're not out there getting it themselves, we can actually act as what's called a fomite and bring that into the home environment. So it's really important that we still treat animals that are strictly indoors. And the other misconception is that because things tend to quieten down in winter because, you know, the fleas aren't as active and the ticks aren't as active, I can stop treating. That's not true because although they are quieter, they are still in the environment, they can still be brought into the house. Fleas will go into kind of like a sleepy stage where they won't do anything, they'll sit and wait until the environment's right and then they'll come back out. And if our pets aren't on prevention at that stage, they will re-establish, they'll cause a problem again and then we'll be back where we started. So it does take a little while to break life cycles and infestations once they start. But if we're on year-round protection the whole time, it is a lot harder for those parasites to get in and start causing a problem. So I think we've actually got quite a few questions coming in from the public. So we'll start working our way through those and Milo will give us a hand as well, I think. So let's have a look what we got. Okay. So how do you protect against tapeworm if regular worming treatments don't cover it? So that's a really good question. And that also reminds us to make sure you look at the packaging and what we're treating because intestinal worms it's a broad category. So you've got hookworm, tapeworm, roundworm, whipworm, that kind of thing. And you probably might find that tapeworm isn't on a lot of the products, especially some of the oral ones and some of the topical ones as well. And what we need to do is firstly consider how tapeworm is transmitted. So there are tons of different types of tapeworm, but the most relevant for us, I guess, is the dog tapeworm, and that's actually transmitted by fleas. So the first step in an integrated approach is to manage the fleas, because if we have fleas that have the tapeworm in them, and then our dogs, because they're itchy, and the cats are licking them off their coat, they're going to ingest it and cause a tapeworm infection. And the other thing is obviously finding products that do actually treat tapeworm. So unfortunately, although the products are really good at the moment, we don't have too many kind of one solution fits all. So it is good to just speak to your vet about a tapeworm specific treatment that you can use in addition to the ones you're using already. And that's usually in a tablet form. Okay, what else have we got? So what's the most important tip you have in regards to parasite prevention? I guess in a nutshell, it is whatever you're using, make sure that you're using it on time. With, say, topical flea preventions, as we get to the end of the frequency that you're supposed to put it, so if it's every 4 weeks and you're going to the 5 weeks and you're missing it by a few days, that's an opportunity for the fleas to come in and get established before we can treat them again. So the most important thing is staying on time and keeping that throughout the year as well, and being mindful if you're going to any areas that have specific parasites that aren't in your own, make sure you're protected against those as well. An example would be heartworm. So it is recommended, because it's so serious, that we're always on heartworm prevention. But if you go to somewhere like Queensland, it is far more common, and you really need to make sure that you're on heartworm prevention there. So just be on time with everything, essentially. What do you reckon? Alrighty, so are there different treatments for different types, sizes of dogs, and how do I know what to ask my vet for? So yeah, we do have different treatments available. So the main thing we need to do is knowing, if you're going to purchase it from the shop, knowing what weight your dog is, because usually all the preventatives are broken into weight brackets, and if you give your dog one that's not for their weight, they might not be getting enough, and it might actually not be working to kill the parasites or the worms. And if you're giving too much of a big one, then we are at risk of overdosing as well. So, but typically the variety of treatments are available for pretty much all sizes. So you will have topical spot-ons, you've got the tablets and the chews for most dogs and cats. So plenty available there. Okay. So do you have to wait a certain age to start treatment for worming? Our puppy is 8 weeks old. It's recommended that we start worming from 2 weeks of age. So if you have a really young puppy or kitten at that age, it might be best to get something like a paste if it's too hard to administer a tablet. But yeah, if your puppy is 8 weeks old, then definitely need to be worming. And at that age, yes, he agrees. Every 2 weeks, and then up until 12 weeks old, and then we do it monthly, and then we do it monthly until 6 months old, and then every 3 months after that. And as I said before, it's because the puppies and kittens are really easily affected and then can cause problems for them. Thank you. Okay, should we treat cats for fleas, worms, even if they're strictly indoors? Absolutely. That brings me back to what I was saying before. Although they may be indoors, we can get the fleas kind of coming in from other animals or on us or the environment, so their larvae and eggs. Actually, the interesting thing about fleas is that they don't tend to jump from pet to pet as much as the pets will actually get the eggs and larvae from the environment. So it is a really important factor. As I said, worm eggs getting stuck in soil and going on our shoes is really important to consider. And then I don't think we mentioned already, but I spoke about heartworm. Heartworm is transmitted by fleas. Sorry, by mosquitoes. And mosquitoes, obviously they fly, they can go through windows, and we've all been bitten by mosquitoes indoors. So if they can get in to us, then they can bite our cats and dogs as well. So indoors, not entirely safe, unfortunately. Okay. So what's the funniest pet patient case you've had? That's a good question. Actually, I think the funniest one is probably before I was even a vet and I was still a student on placement, and a lady brought in a frog and she told me that he got electrocuted and died, and then it came back to life. And I remember just thinking, wow, I've got a lot to learn, because I didn't know they could come back to life. And I just sat there looking at it thinking, wow, I don't even know where to start with this one. But yeah, I've always remembered that one. That's a really good one. Yeah. Okay. Thank you. So what is the best flea, worm, tick treatment for domestic adult cats? Actually, now's probably a good time to start talking about our products. If Winchester wants to come through, we've got a few different ones available for cats and dogs, but especially new tick treatments now for cats as well.
Hi everyone, I'm Winchester. I just work at Pet Barn here. And I've brought over a couple of the products that we use and to sell into the store and to help advise customers and things that we use as well. So we have over here Advocate for your cats and your dogs, and it just is a couple of the different ones. There's also NexGuard and NexGuard Spectra. Now NexGuard, just the normal one, just does your fleas and ticks, and then Spectra is the one that covers for a lot of your other parasites, things like worms, heartworms, and things like that. There's also, if I can get these ones to stand up, there's also Bravecto for cats, and there's also Bravecto for dogs. Now, the one thing with Bravecto that I just want to let you guys know about is that they actually come in the topicals as well. So the dogs, they released a new range that does topicals, and for the cats, there's also the ones with the topicals, and Advocate as well. In terms of just like fleas and ticks and what we can do for them, the good thing with all of these ones is that they're all rated really, really well, and that they do exactly what they say on the box as long as you follow the instructions. So you can actually use things like NexGuard, these two, from 8 weeks of age. So you can give it to your pups or you can give it to your dogs and stuff, and they work really, really well for doing your fleas and your ticks, your paralysis ticks. They do brown dog ticks and also bush ticks as well. And there's also Bravecto. So Bravecto also you can use from 8 weeks of age, and the good thing with this one is it's a slow release, so it lasts for about 3 months. So one chew will be able to treat your fleas for 3 months, your paralysis ticks for about 4 months, and your other ticks for 2 months each. But it works really well because it's a convenient solution, particularly if you're not can forget sometimes, because we all do it. Otherwise, NexGard, you give them every monthly. Advocate is a really good solution as a topical one. They've been around for quite a bit, but they've worked really, really well. Now, they don't do ticks, unfortunately, but they do cover for your fleas, your heartworm, and a lot of your intestinal worms as well. So things like hookworms, roundworms, and stuff like that. And same thing for these other two products.
Excellent.
Yeah.
Another really good thing about the 3 monthly products is that because for adult dogs we should be worming them every 3 months, it's a really easy way to sync up the schedules. And some people often find that if they do it at the start of every season, they won't forget that way. So put it on your calendar, do it at start of spring, start of summer, and then you're definitely on track. So that's really good.
Yeah. So you can definitely keep up on top of it. And yeah, for a lot of cats as well, the topical solutions sometimes work the best because not a lot of them like chewables. Thank you. So this one is repeated use of Bravecto safe for my Shih Tzu? Absolutely, yeah. Bravecto is absolutely fine to keep using as long as you're giving it according to the proper dosages and instructions. So if you're giving the chewable version, they last for 3 months. So you just give it on the end of every 3rd month, and as long as you top it up on your calendar, it's absolutely safe. The topical ones are a little bit different. They last a little bit longer, so I'd probably come and visit your vet or your local pet barn staff member and ask them about it to get the full details. Yeah. Nice. Thank you. This one says, my Schwinn keeps chasing his tail. Is this normal? I believe, yeah, that is quite normal behavior for a lot of dogs. But sometimes as well, do keep in mind, because if you know you're, say, living in a particularly high-risk area, or you might be a little bit behind on your flea and ticks, sometimes it could be indicative that they might have fleas on them or ticks or anything. A lot of dogs' behaviors like that, which we can initially write off as fairly normal, might be indicative behaviors that something is there, and it never hurts to check anyway, because it only takes a couple minutes of your time, and always treat them. Yeah.
And fleas love to go around the back end as well, so especially we spoke briefly before about flea bite hypersensitivity. So if they're allergic to fleas, they tend to flare up around the tail base and around the back end. So if we're having lots of irritation over there, definitely go to a vet and have that checked out.
Yeah, so that looks well. That's for you.
So what worm flea tick tablets do you recommend for dogs? So if you're going for tablets, you want something that covers most of the worms. Something like Drontal is a good product that does your intestinal worms, and if you need to make sure, because that one doesn't do heartworm, it's just intestinal purely, so fine to use every 3 months, but then you will need to get another product for your heartworm and something else for your fleas and ticks. So that just shows that we just need to be aware of exactly what we're covering, so that we can find a routine that works best. So for example, if we did Bravecto and Drontal every 3 months, you've got coverage for everything except for heartworm. So you can either just get a heartworm chew or ProHeart, and it's all good.
Yeah, or visit even your vet just to get the heartworm injection annually. Whatever really works best for a lot of you, because you can always discuss that and work around your budget and things like that as well.
Yeah, absolutely.
Thank you. What's your favorite breed of dog? Well, for me personally, I've always been favorites of German Shepherds. I've got a couple myself and my little Maltese Shih Tzu, which is always fun. So they make up for quite a bit of a size difference. What about you? Oh my God.
My favorite, I've always loved Rottweilers, so
yeah.
It seems like we both like big dogs.
Yeah.
I've had 2 before, but if I was to get one now, I love all the mixed breeds that come through. So all the, like if you go to a rescue place and you just find that you can't even tell what they are anymore, but yeah, just the variety is awesome. So
yeah, and it's always fantastic as well.
Yeah.
So that's good. Yeah. This one says, what's the best way to clip my cat's nails?
Okay, so we'll pretend Milo's a cat for a second, because it is quite similar. So basically, it may be a 2-person job, but essentially, when we're looking at the nail, and cats are pretty easy to see, they've got a pink fleshy part inside the nail, and that's called the quick, and that part is living tissue. So if you cut that, it will bleed and it will be sore, and so you're just going to cut the white or the clear area. And with cats, they do have retractable claws, so if you just put a bit of gentle pressure there, so Milo's claws are already poking out, but a cat, you'll just push it and then it'll come out, and then you just clip a safe distance away, probably 1 or 2 millimeters away from the quick. But if you are unsure, then just go to your vet and we can demonstrate how to do that for you in a safe way. Sometimes cats don't like their feet being touched, so we put them in a little towel so they feel secure, get lots of pats, and dogs, we often give treats while they're doing it so they're distracted enough. But yeah, so just making sure essentially that we're avoiding the pink part in the nail, because that will be sore if we cut that one.
Absolutely. But I mean, just in the case, you know, that you do cut it or anything, don't panic. It's never actually a super big issue for a lot of dogs and the cats. They might, you know, be a bit shocked and stuff afterwards, but if you have like a wound guard or any antiseptics and stuff on hand, just wash it liberally and then apply it on to make sure and they're okay afterwards. Sometimes as well, the nails can be a bit black, so it's a little bit hard to see. If that's the case, play it a little bit safe, you know, I wouldn't risk it, and take them down to your vet so that they can see what's going on. Or, you know, sometimes flashing a bit of an LED torch sometimes helps as well if it's particularly dark. Yeah. Thank you. Alrighty. This one says, what should you do if you have a dog that's never been vaccinated? Is it too late?
Yeah, so absolutely never too late. The only thing we do need to consider is, you know, what their vaccination history is. So you've already said like not vaccinated, that might be different to a dog that has been vaccinated. And the other thing is age as well. So if, depending on the vaccine used, a lot of adult dogs, we may be able to just give a one-off without having to boost, but some vaccines, they will need a booster 4 weeks later. So that will depend on what your vet is using. But if it is a puppy, they will need boosters. So we generally start at 6 to 8 weeks, and we go every 4 weeks until they're 14 to 16 weeks old. So usually that means getting 3 vaccinations. And just a fun fact that's because they've got maternal antibodies circulating. So they drink from their mum and they get antibodies, and that actually interferes with the vaccine. So we need to wait until they're out of the system before we can say, yep, this vaccination has lasted a whole year. So just check with your vet if you're unsure about that.
Yeah, for sure. Yep. Alrighty. And how soon after vomiting can I feed? It really kind of depends sometimes as well. You want to make sure that they didn't ingest anything particularly toxic or poisonous for the first thing.
Yeah, absolutely. So vomiting can be caused by a number of things, and most commonly, you know, it's because they've eaten something that they shouldn't, or it could be even be a bit of an upset from an infection. But if it's just a one-off, I'd recommend probably not giving food for a few hours and then offering a small amount, seeing if they're keeping it down and there's no other issues. But if they are continually vomiting, if there is diarrhea, if they're off their food, lethargic, not themselves, definitely get them checked out first, because it could be a warning sign for a more serious problem. And that's actually all we have time for today. So thank you so much for joining us for this live Q&A. It's been really good to share this info with you, and I'm sure you have more questions now that we've opened a can of worms, so to speak. But so just keep sending them through, and we can answer them after the Q&A. But if you want to chat with your vets or friendly pet barn staff, just
come on down.
Absolutely. Yeah. Alrighty, thanks guys.
No, see you later, folks. Milo.